Hello all, this is going to be my impromptu speech about radiology and the different pathways that are following it. Radiology is pretty diverse. There's different um, levels to this. The most basic level that radiology starts at is radiography. That's currently what I just graduated in. Radiography uses radiation to take pictures of bones. These pictures usually show any fractures, any bone spurs, etc. If you were to break your forearm or your wrist, this is what would be first taken when you go to a hospital. They would take an x-ray of your wrist or your arm. Moving on is CT. CT uses contrast material for the most part. CT does exert a lot more radiation, so it's a little bit more harmful to the body. But the pro to CT is that it shows a lot more in-depth detail to what's going on in the anatomy of interest. So there is pros and cons to this. CTs are the most used type of diagnostic imaging currently. Next to CT is MRI. MRI is magnetic resonance imaging. MRI thankfully does not use any radiation. They use magnetic imaging, which is in the name itself. The magnets pretty much surround themselves around the body. Targeting pixels pick up on what is abnormal in the tissue. Whatever is abnormal in the tissue ends up showing up on the x-ray monitor. MRI shows any tears in the ligaments or tendons, and it is a better visualization of soft tissue in the body. Moving on, we also have nuclear medicine. Nuclear medicine goes hand in hand with radiation therapy. Radiation therapy and nuclear medicine are often used as therapeutic types of treatment. Radiation therapy is usually mostly used for patients with cancer. This is where radioactive material is injected or put onto a patient's skin to reduce inflammation and reduce cancer cells. Nuclear medicine is injected into the body, and what is used is as kind of like a contrast material. Once the radioactive material is in the body, it pretty much lights up wherever it is injected inside the body and shown on the monitor. This is where they can use the pathway to figure out where to go next and what is abnormal, what is not abnormal. And I think this would be our fifth pathway to radiology, is ultrasound. Ultrasound uses sound waves. There's no radiation involved. The sound waves create an image and show up on the monitor. Ultrasound also breaks down into a few different pathways. There's ultrasound for OBGYNs, there's echocardiography, which is used to listen to the heart. There's also neuroskeletal ultrasound, which is used to look at the brain and the skeletal system. Ultrasound is kind of its own little wing. It doesn't directly fall under radiology just because there's no radiation involved, but it is a little bit related just because it's used as imaging and diagnostically used for imaging and just seeing what's wrong. All of these pathways are read by a radiologist who is a doctor of radiology. The radiologist must be able to read, interpret, and treat according to these images. So they must master how to read an MRI, a CT scan, an X-ray, an ultrasound, etc. So here's my impromptu speech about radiology. I hope you guys enjoy.